and welcome to the GHA GDDS User Group conference call. All lines are now fully interactive. Please be aware that any background noises, conversations, or placing a line on hold will broadcast into the conference. Please utilize either your phone's existing muting function or via touch-tone phone. You can press 6-1 pound to mute and 6-0 pound to unmute. Please also note this call is being recorded. I would now like to turn the conference call over to your moderator, Leslie Sanovich. Ms. Sanovich, the floor is yours, ma'am.
Thank you very much. Good morning, everyone. Welcome to the March Data User Group monthly call where we discuss issues regarding the Georgia Discharge Data System. Bill Wiley is not with us this morning, but Sharifa Navos, our Data Integrity Specialist, is with us. Good morning, Sharifa. Can everyone hear me okay and see my screen?
Yes.
Thank you. Well, our agenda is similar to last month, but as always, as we move along in the call, don't hesitate to chime in with questions. This is your call. It's an open forum, so as we move through the agenda, please feel free to ask a question or ask for something to be demonstrated. So the first thing I wanted to talk about was the 2019 data submission schedule and publication. We have received the fourth quarter 2018 of the limited data set for those of you who subscribe to the limited data set. There is going to be a change in the way that data is accessed beginning for this latest release. We are going to be using a product known as Box, B-O-X. It is not the same as Dropbox. Box is FISMA and HIPAA compliant, and so the link that you will receive, and you will receive detailed instructions, will be a Box link, and then you will receive the password in a separate secure email as well. I know not everyone subscribes to that limited data set, but I did want to mention that data will be forthcoming by the end of the week. Those links will be distributed, and then also Javion will be in the process of loading that fourth quarter data onto the platform so that you can begin using that data. While we are talking about the limited data set, I'll give a quick overview of what that is in case we have new users. The limited data set is a de-identified patient-level file that is released of all the Georgia data that is released quarterly currently, and it's on a rolling basis. So the latest release, the fourth quarter release, will contain first, second, third, and fourth quarter. And then, of course, we'll do a final release at the end of July, beginning of August. The cost of that, it is a subscription, is $12,000 a year. It does include the inpatient and outpatient data, and there is an order form, just to give you an idea, on the GHA website, and I'm going to be demonstrating the GHA website a little bit later, and I'll show you where that is, but it's a data form that you can order historical years or just the current year, and that is to be loaded into the hospital system or the healthcare facilities system. We do allow, if you have a consultant agreement with a consulting company, they may have access to it, but they are not to load it into their own data systems. So that is what the limited data set is about. And if you have other questions about the limited data set, don't hesitate to give me a call, and I'll be happy to talk with you about that. But I did just want to mention that to you. All right, so next, I just want to give a quick overview of what the GDDS is, because I do believe that we have a couple of new users. Most of you all are familiar with this, but by state law, hospitals are required to submit their data to the Department of Community Health, and we are the vendor for that. You submit your data in the UBO4, the Uniform Billing 2004 data layout that actually has been customized for Georgia, but that submission is submitted to our vendor, Heidi, who is a subsidiary of the Missouri Hospital Association, a sister hospital association. and then that data is run through a number of checks. Different values such as geographical codes are assigned, DRGs are assigned, care service lines, and that then becomes what is known as the Georgia Discharge Data System. We then distribute that data on your behalf to the Brain and Spinal Trust Fund Commission, to the state of Georgia, to the Agency for Healthcare and Research Quality, and to the HCUP, the Healthcare Cost and Utilization Project. And those are for research purposes that data is used after the researcher has been fully vetted and commits to a data use agreement with AHRQ. And also GHA has final approval over any of those data research requests. Any questions about the Georgia Discharge Data System? I usually don't pause and ask for any questions, but does anybody have any questions about this process? All right, then we'll move forward. I'm going to turn it over now to Sharifa because we do have the first run at a full year of 2018 data. So now is the time where we really are pushing internally, and we encourage you to review your data submission for 2018 because we would like to make any corrections or fill in any missing gaps of data before we close on July 15th and begin, we'll close the 2018 data for good, and we'll not be receiving any more updates to that 2018 data set. So, Sharifa, if you want to go ahead and talk about how to verify and review the data.
Yeah, sure. Good morning, everyone. So this slide really is showing you where you can go to access certain reports that relate to the data that you upload through HIDE. And as Leslie stated, we are closing the 2018 database in mid-July, and that's in the schedule. So we encourage the data uploader or anyone that's responsible for reviewing the data in your facility to look at these reports and kind of do a quick analysis of everything to make sure that your numbers the volumes are correct and the distribution is even, and that there is no major issue or discrepancy in your data. And I'll be doing that also. So throughout, I guess, these few months before July, you'll be receiving emails from me if I find any issues with your data, so that we can correct them before the close, and that the data is clean and nice when the database closes. So this is under the report section of the HIDE website, where you can click on the verification report you see there at the bottom. And you can go to the next slide, Leslie. So that report used to have about 8 pages. Now it's 14 pages. They added a few more pages related to zip codes and physician information. So this is the first page, which kind of gives you an overview of each month and each quarter and where your data lies in terms of the volume, like I was saying, so how much data was uploaded, and then the distribution of data. So you'll see at the top here, like if you look at quarter 4 there, and you'll see that the previous year, 2017, had 7,456 records, and then 2018 has 2,590. So you would want to look at what happened here in November and December to see why the data was not loaded properly, or whatever the case may be, and then you would just look internally, delete the old file that you submitted, resubmit a new one, and just make sure you clean that up. And so that kind of gives you an overview of everything on the charges and the diagnostic and procedure counts as well, and it has a comparison between the previous year. Go to the next slide. This also shows you distribution by patient type, and that's very important in terms of looking at the inpatient types, swing beds, other inpatient, unknown patient types. So you want to make sure that that's very that's similar from year to year, and that if there is a drop, if something happened like one of the departments closed in your facility, it's always good to email me and let me know. Then I can include that in my final notes to the study, which is where you can also see, what facility had a drop in their data based on whatever, so that when you do your analysis, you know what's going on. And so that shows you the distribution of the inpatient and outpatient types. Next slide, please. Yes. And this is the primary payer, which is important as well, showing you how many Medicare, Medicaid, self-pay, and again, just look at your previous year, your current year, and just make sure that those numbers, and I'll be doing that as well, but we encourage you to do it so that, you're not caught off guard and you can make those corrections sooner than later, and that your data will be correct before the close of the database. So you'll see that distribution and the volumes for that as well. Next slide, please. This is for outpatient, same thing. The distribution, you can kind of glance at it, look at the numbers, make sure there's no, and at the bottom in red, the percentages show you if there is, and I'm not sure if it's a 10% difference, but it shows you if there is major discrepancies, and you can look at that and make sure that it's not too major, because sometimes it'll be like a point, like at the bottom, 0.16%, that's not major, but if it's like a 50% or 20% difference, you want to see why the numbers either increase or decrease that much. Next slide, please. This one, same thing, admit type, point of origin. So these are just things that every time you submit a new file, this is generated by Heidi, and so you have that to look at. And we recommend you do it every time you submit on a monthly basis, just because you can catch them early, because this is generated for you under that report section, and you can access it, review it, and see where you have any issues. You can go to the next slide. And this is the last one, or I think second to last one, the patient's disposition, so where they went after being discharged. And as you can see, the home and self-care is usually number one, and then you have, other categories at the bottom, and you would just look at those. Like I said, there's a 2017 one, and then this year, just to see where you stand and if your numbers look right. And this is by race, and I think there's an ethnicity and gender as well, so you can look at that for demographics information. So these are the new pages that were added, and this is by the top 250 zip codes for inpatient, and then if you go to the next slide, there's also one for outpatient, so you can look at that if you're looking at where your patients are coming from or what zip codes they're coming from the most. You can definitely look at that. I think it's a great resource as well. Then, like I said, there's the frequency by DRGs for inpatient. I think, go to the next one. It's just inpatient, and then you have your attending physician for inpatient and outpatient as well. We had to block out the names just because for HIPAA purposes, but when you go into your own reports, you'll be able to see the physician name. So that's
and
a
Sharif,
good
just talking about physicians, I do want to kind of remind everyone on the UB, on the file that is submitted, there is, I believe there's actually 4 places where you can put in a physician's NPI number, and the first one is for attending physician, the second one is for the operating physician, and then the third and the fourth are up to the discretion of the hospital or the coder. But we do, in the UB04 layout, specify that the first field for NPI should be the attending physician, and the second should be the operating physician.
Thank you, Leslie.
Mm-hmm.
You can go to the next slide. So, and as I said, these are generated, but what you'll get by email, and this is how you'll know that your data was uploaded, at least in the system and successfully is by receiving the edit summary report in your email. And I get one as well whenever you submit something, and that's the report that shows you your fatal errors, your warning, and there's also an edit detail report that shows you your informational errors, which don't count towards, obviously, the fatal error rate, which is what we look at to make sure that your data falls within that 3% threshold. So as you can see from this example, the fatal error rate was 0.22%. That's good. If you want to go in and correct them, if you see that there's 3 records that are, the status is missing, you can go in there by using the edit detail report, which is also under the reports tab where the verification report is, and you can go find the medical record number, correct those, and make sure that it's not a trend or something that keeps being missed by either billing or whoever enters that information in the chart. So a lot of people like to look at those detailed reports even for their warning errors because they want their data internally to be clean. And we do recommend that you make those corrections in your system and not in HIDE because we want it to match. So in your system, you want to make the correction, delete the file that was previously uploaded in HIDE, and upload a new file, and extract it, upload a new file so that the data is clean on both sides, and it actually saves you, double work correcting it in one place and then not in the other or in both places. So it's always good to do it in your system first. And so you'll have 2 pages, one for inpatient, one for outpatient when you submit the data file, and that comes directly to your email. Go to the next one. So yeah, and this is the edit detail, and these only show you the fatal error records, and then it'll also list if there was also a warning or informational error in that same record. But you want to focus on fixing that fatal error first, like the zip code missing, and little things like that, especially demographic information. Those are considered fatal errors because they do, that's the major component of the discharge data.
Thank you, Sharifa. Are there any?
Okay. Anyone have any questions? Yeah. Yes.
Go ahead if you have a question.
Oh, no, I was just asking if anyone had any questions about using those reports to kind of go through the 2018 data. Well, thank you. And this is the schedule, I guess, that Leslie will go over with you.
Yeah, we updated it a little bit, and Sharifa will be posting it to the GHA website. Just made it a little simpler to follow. The last due date for the 4th quarter data was the 15th, and she is going to be updating the 2019 schedule as well. But, the years kind of overlap because we're receiving 18 data and 19 data. And again, the final will close the 2018 database by the end of July. We'll do it as soon as possible, but once we close the year of database, we do not allow any changes to be made to it. So please keep that in mind. And, if you need help reviewing your data, Sharifa or I would be happy to get on a call with you and your team to look over your data and verify any, or answer any questions you may have. So please know that we're here for you. All right, moving on, I'm going to talk about, and we talked a little bit about this last week, accessing data services resources on the GHA website. We have moved a lot of our resources. I'm going to, hopefully I'm still logged in, drag my screen over to the GHA website, and I think it did log me out. So it's just gha.org. If you do not have an account, it's real easy to just sign up for a quick account, but you do need an account to access a lot of these folders, so it did log me in. We have updated, it used to say data and finance, now it just says data, and this takes you to our portion of the GHA website, and we have the Georgia Discharge Data System is what most of you are interested in related to this call. And one area that we do have is member reports, and not everyone has access to that. If you have questions about who has access for your facility or you would like access, these are, in the member reports, are folders that contain reports about the hospital. A lot of them are, I'm just going to show you, like the economic impact report, which also we are working on currently, and that should be available by the end of March. But we also engage with another sister hospital association, the Hospital Association of New York State. They have a subsidiary known as DataGen, and they produce, they get the sample data from CMS, and they produce modeling reports related to finance, policy, and quality. And so we subscribe to those reports on your behalf. It is no extra charge to you, and we post those reports in these folders. So, you know, a COO or CEO or some directors would probably want to have access to these folders. Not everyone in the facility would need to have access, but we do have to grant, it's not PHI, but they are confidential, you know, and sensitive material that you would want to, you know, only have certain people have access to. But Sharifa manages these folders and who has access and how the approval process works. But just to give you an example in the quality, we have Medicare quality programs. There's the measures trend analysis. There's the value-based purchasing for critical access hospitals. If we go back, and this is just, you know, a few examples that I have access to. You would only see your hospital or your hospitals in your system. But if we look at, there's a readmission analysis, and we have kind of archived the 2018. And the reason I bring this up is, one, I want to make you aware that these reports exist and that you know, should utilize them and use them how you can. But also the fact that we, DataGen has offered, as they do annually, to host some webinars specifically for Georgia. The first one is going to be Thursday, April the 25th from 3 to 4 p.m. And this is going to be a review of Medicare's value-based purchasing program and analysis specifically for Georgia hospitals. This is just an example of what one of the reports looks like. I've excluded the hospital name, but that's the first one in a series of two. And there will be a registration link, and I already have it, that will be distributed next week. So be on the lookout for that. If you're interested in hearing about that, this should be a really good call. The next one will be on May the 22nd, and will be about the readmission reduction and hospital-acquired condition program analysis for Georgia. So please stay tuned for those links and get registered. We'll send out lots of reminders, but those should be good educational opportunities on how to interpret and understand these reports and the impact it has on Georgia and specifically your hospital. All right, going back to the GHA website really quickly. So we have those reports in the member folders. I'm going to go back to the data side and just remind you that we have put all of our forms in the Data Services Resources tab. So the authorization forms are here, notes to the study. We're still working on the YouTube channel to have the recordings and of the WebEx and these calls available, so that should be available by our next call in, I can't believe, April. So just know this is a resource that you can come to if you have a question about where something is. Give us a call, or if you have a suggestion about another document or resource to place here, let us know. But this is kind of our holding page for all of the data services resources. Any questions? The last update I'll give you is regarding our readmission tool that Bill has been mentioning for quite some time, that is going to be made available first to a select group of critical access hospitals to make sure everything's functioning properly for them, and then is going to be opened up to everyone else at no additional charge. We were able to provide this through a grant from the State Office of Rural Health, and this is not it. This is the visualization tool, but the readmission tool will be updated on a monthly basis. So we're excited about that, and also, want you to be on the lookout. If you don't have anyone signed up yet, that we do have a pretty stringent authorization policy. We have to have a CEO authorization form first, identifying users that they deem appropriate for the facility, because you will be able to drill down to the patient level. And then once the CEO has identified those users, we will send a user acknowledgement form out to that particular user, and they will be set up with a user ID and login. Keep in mind, when you are set up as a user, you will be receiving an email from, I believe it's support@Javion, and we know that from the visualization tool setup that a lot of those emails ended up in people's spam folder. So we'll try to follow up with you when we know the email notification has gone out, and we're anxious for everyone to be able to jump on board and use that tool.
Leslie, I have a question. This is Deborah.
Hi, Deborah.
Hi. I have really not been into any of these menus, and I was trying to find, like, the data and the different parameters. Is that in the Javion? Is that you sign into Javion, or are you getting that from GHA? You just had a screen up there with some different parameters.
Okay, this is the GHA screen, and I was on the Javion visualization tool. Is this what you're talking about?
Okay, that's where, that one right there. So to get to that, you have to go on to Javion, sign into Javion?
Yes, this is the Market Trend Analysis tab on the Javion visualization tool.
Okay, and I think mine said it was empty, so I'm not sure what that's all about. I mean, I couldn't bring up any data or anything.
Okay, well, I'm making a...
Leslie, sorry, this is Sharifa. If you're using anything else than Google Chrome, it will give you some issues. So are you using Google Chrome or Firefox?
I've got Firefox open, and that's what I use most of the time, but I know that the preferred...
Internet Explorer will give you some issues.
Right, Edge or Internet Explorer will give you issues. But if you're still having difficulty, we'll work with you one-on-one to see what's going on.
Okay, thank you. I just haven't had
or email me.
And I'll get with you. Thank you.
Okay. Any other comments or questions? Guys are a quiet group this morning. Well, currently this data is through, as you can see, September 2018. Within a week, we should have the fourth quarter data and the refreshed quarters of data uploaded into Javion. And when they are making those updates, we also have kind of a laundry list of to-dos for them to clean up a few things. We noticed that there were a few issues with some of the facility names that have changed. It wasn't updated across the spectrum of years, so we are aware of that and are working with Javion to clean up a few of those issues. This is also a good place to look at, I know Sharifa went over in detail the verification and edit reports that are available on HeidiNet, which is the submission portal. However, not everyone has access to that portal. Only the submitters or people that log in and submit the data have access to that portal and those reports. So if you're just a user, this is a place where you could look at your distribution of data for your facility year over year and look at your payer mix. This would be a good place to do some spot checking before we close the 2018 data.
Hey, Leslie, this is Ashley Taylor. I have a question.
Yes, Ashley.
I know we're the newest ones probably looking at any of this, but do you have any kind of documentation on how you determine your inpatient service lines or even your outpatient?
We don't have any documentation on it, but I'd be glad to, we'd be glad to have a WebEx with you and your team to go over some of those.
Okay, that would be great. I was curious in particular about neonatal and newborn.
Okay. We can certainly do that. Any other questions, comments?
I believe it was brought up on a previous call, but being able to set up custom service line definitions, have you guys been able to look into that at all?
It's on our list. Currently, it is not available, and we're working on. And when you say custom service line, are you talking about?
Based on DRGs.
Based on DRGs. We are working on, I think what we're going to end up doing, because we've had lots of discussion about this revenue code analysis, is that we're going to add another tab that specifically deals with DRGs. As you know, the DRG analysis would just be for inpatient data.
Yes.
So that's the plan, is to add an additional tab so that you can select specific DRGs and work on that. Now, I don't know that the functionality will be available for you to save and say, okay, this is my specific service line. I'm not sure because of the licensing, this is a Tableau-based product, allows us to do that. I think if we begin to have reports that are quote-unquote savable, then we get into needing to purchase a license for every user, so to speak, if that makes sense.
Okay. All right. Thank you.
You're welcome.
I have one other question. On this tool, and I'm not sure if it's in the underlying data yet, but like a facility type filter, because I noticed you have, ambulatory surgery centers, hospitals, rehab hospitals, LTACs, or et cetera, so being able to limit to acute care hospitals or something.
That's a very good suggestion. Thank you. We'll take that into consideration. We don't have that currently. You can, though it would be cumbersome, you can certainly select particular facilities, but yes, that would be cumbersome to, weed out or to exclude LTACs or specialty hospitals. So we can talk about that for sure.
Thanks.
Another thing I'll remind you of about the data is that when we're looking at discharge status, we have what's hopefully most of you are aware that we have a data and technology committee that governs, so to speak, the Georgia Discharge Data System. Of course, when the Georgia Discharge Data System was created, there were a lot of things that had to be decided on about what data can be released and how the data was to be formatted. And it was decided and approved by the Data and Technology Committee and then the GHA board. And that committee consists of users from a broad spectrum of hospitals that we would not display mortalities so that anyone who is discharged, has a discharge status of a death, that is translated to discharge to home. So you will never see mortalities in this data, and that's just simply so, we don't want to publish mortality rates by hospital and begin to do comparisons that way. So that was to protect each other, I guess, so to speak, from how the data is used. So I just wanted to point that out every once in a while that you will not see mortalities in this data. Any other questions or comments? Well, I won't belabor the point then, and our next meeting will be on April the 3rd, and we will look forward to being able to report that the fourth quarter data has been published and that the readmission tool is live and people are using it, and we'll have an update on that. And in the meantime, if you have any ideas or questions regarding this call or topics that you would like to see covered, please don't hesitate to let us know. And as always, we are here to support you in the Data Services Department, so please reach out to us and let us know how we can help you. If there are no further questions, we will adjourn today's call and hope you have a good rest of the week. Thank you.
Thank you.
Thank you.
Thank you. All right, bye-bye.